think importantly for the public's protection, this time around the medical board was allowed to examine the care given to patients that were receiving medical marijuana cards. So if the Board of Health, which was overseeing the applications and cards distributed, saw some loud signal at one doctor's office that lots of cards were being issued to patients, the medical board could actually audit the practice and make sure it was legitimate. And this is very common for doctors who prescribe stimulants or narcotic analgesics. You know, if they're over-prescribing, it's either the DEA or a medical board that will check on their practice and make sure they're not diverting or prescribing inappropriately. And then the last part of this was, if a patient under the age of 21 were to receive a medical marijuana card, 2 different physicians, independent physicians, had to concur with the recommendation. Okay? So I include this slide in here because throughout history we've been really blessed with all kinds of medications that were derived from botanicals, from plants. For example, the willow tree, we get aspirin from the willow tree, and as you know, aspirin's a great drug, not just for headaches, but it can prevent clots. There's some evidence that taking an aspirin every day may lower your risk for colon cancer. But the point I'm making is we didn't just take the willow bark and send it to the public and say, chew on this and maybe you'll get better. All of these drugs were developed through rigorous research trials and never reached the public until the Food and Drug Administration decided that, 1, it was safe for the public, and 2, that it actually worked. So for the medical marijuana industry, it's totally abrogated the role of the FDA in that regard. Okay? Now, I don't want to say this is all bad news, because there is some evidence that marijuana may play a role in medicine, but we have to research it the way we do any other treatment that we expose the public to. But some promising areas would include helping to stimulate appetite, and a lot of patients getting chemotherapy or who are very ill for other reasons and are losing weight because they're just not hungry, this could be very beneficial. And reducing nausea. There is some promise that marijuana can be helpful in reducing muscle spasms. For example, patients who have multiple sclerosis sometimes get very painful muscle spasms. A reduction in certain types of pain. I've talked about the glaucoma. And something of real keen interest is reducing a certain type of seizures in children that tends to be unresponsive to conventional medications we have. What's important about that is it's not the THC, the tetrahydrocannabinol, which is the psychoactive substance in marijuana. That's what creates a high or a euphoria. It's actually another component of the plant called cannabidiol, or CBD, that doesn't cause any psychoactive effects, but appears to help put seizures in remission in some of these children. It's been a very small number, but it's a very promising area for research if we can help these children. Okay. This may be a little too scientific, but the point with this slide is to say that receptors for the components of marijuana are all over the central nervous system, all over the brain, all over the spinal cord, and including in the periphery of the body associated with the immune system. Okay? And I wanted to just show you this slide and just, if you can have a photographic memory, see where coordination, movement, judgment, the reward center is basically where the brain can get primed or stimulated in a way to lead to addiction. So that's a very important consideration. And then the part of the brain that is responsible for memory, that's something called the hippocampus, is really important too. That area of the brain allows new learning and also laying down new memory. So when you think of an adolescent in high school, that's a very important part of the brain. Okay? This next slide just shows the concentration of receptors. Those are places that will accept THC from the marijuana plant. And you can see heavily concentrated in that reward center. So, you know, I think it's very supportive of the fact that marijuana can lead to addiction. It's also where we lay down new memory and we have new learning, where we have balance and motor coordination. And then at the front of the brain, that is where, that is where we have executive functioning. And what that means, it's a higher order of the brain where we might have some data and we analyze that data and we come up with a plan and then we execute that plan. I mean, as adults, we do that every day in our jobs and even raising children and driving a car. So a very important part of the brain, and marijuana can, or components of marijuana can densely populate that part of the brain and interfere with that function of the brain. Okay. I'm going to skip that one. I really did look at all the research as I examined this issue and kind of, for myself, weighed the pros and cons. The literature shows that for people who are smoking, you know, at least 4 joints or more per week, they really do poorly on certain types of tests of mental capacity. And in this study, they were looking at decision-making tests. And for those who were long-term users, pretty much meaning every day for at least a year, they had impairment 70% of the time on the testing. And then for those individuals using marijuana less frequently, but using it nevertheless, their impairment was 55% of the time. And you see that last group, for non-users, it was 8% of the time. They may have had some other deficit unrelated to marijuana. This was a study that really caught my eye because when I think of a substance like marijuana, just like I think of alcohol or other drugs that can affect cognition, I think of people who are in safety-sensitive employment, like airline pilots, like physicians, like people who work for the Department of Transportation and drive commercial vehicles. This was a study that took 10 experienced licensed pilots, and they were trained for 8 hours on this flight simulator test. And after they got that training, they were each given a marijuana cigarette to smoke, and it was all the same concentration across the board. And then 24 hours passed, and the pilots were tested again on the same simulator test, and all of them trended toward impairment and you know, just not doing well despite having spent 8 hours learning this activity. And what was most concerning is that the pilots themselves didn't recognize they were impaired. Now, it'd be different if they recognized it so they could, you know, step out from flying a plane, you know, if they were using this substance, but they didn't know they were impaired, which is more dangerous than the impairment itself, okay? I included this slide just to show you why marijuana is not necessarily the benign substance that it may have been decades ago. Between the years of 1998 and 2008, the potency of marijuana seized, you know, the marijuana grown illegally and seized by the government, has increased by 103%. So what's out there right now on a routine basis is much more potent, and rather than just causing a high, can actually be more psychedelic and cause psychosis or hallucinations. Okay. I didn't know what this was called blasting or dabs until I had a woman in my private practice I was treating for depression. And she came in one day very puzzled, and she said, you know, my 14-year-old son has these butane cans in the trunk of our car. And I just, you know, tried to think, what could this all be about? And I thought, you know, is he inhaling this stuff, or maybe he's setting fires, or, you know, what could this be about? So I did a little research on the internet, and basically what is happening in Colorado and probably other states as well is that a hashish oil is produced, and that's a really condensed concentration of THC in an oil. It's then infused with butane, and when it's lit, what gets inhaled is up to a 90% concentration of THC. And I want to compare that to what used to be out there, maybe in the 60s or 70s, 6, 7, 8% concentration. So you can see the exponential potency and why that might be a problem. And this, just demonstrates the technique on a magazine. And with this, in Colorado, we've had some explosions, and you think butane cans and mind-altering substances, what could possibly go wrong, right? And it is kind of funny if this were a Cheech and Chong movie, but there's actually been some, lab explosions, and unlike meth labs, people are doing this in their cars, so, you're just minding your own business driving down the road, and a car next to you has an explosion, so a little bit different. Something that's really complicated and has caused a lot of controversy between those in favor and those opposed is the fact that we really don't have a way to measure marijuana in the blood or the urine that correlates with impairment or the lack of impairment. And with alcohol, it's a little more simple. For most states, it's a 0.08 cutoff, and generally under a level of 0.08, people are not impaired when they drive. There are exceptions, but it's a pretty good, accurate measure to determine whether people should be driving or not. Well, with marijuana, it's complicated because in levels as low as 1 to 3 nanograms per milliliter, that's a tiny, tiny amount, you can have some cognitive impairment. And for many of the medical conditions I discussed earlier, patients need about 10 nanograms per milliliter to get some therapeutic effect. Many of the scientists that were looking at this wanted a zero tolerance policy in Colorado. Just, either it's in your system and you can't drive, or it's out of your system and you can drive. But there was a lot of pushback for those in favor, and knowing that people who use this medicinally, as well as recreationally, will have higher levels. So the compromise was the cutoff would be 5 nanograms per milliliter, but it is absolutely meaningless from a scientific place. It was a compromise, and we really don't know who's going to be driving impaired and who's not with this level.